Good news hidden in the data: today's children are healthier. For the first time in over a decade, the death rate in the United States is getting worse, the Centers for Disease Control and Prevention has reported. The news is the latest in a string of headlines about the shortening lives of Americans, particularly the white middle-aged. Disparity in lifespans of the rich and the poor is growing. White Americans are dying younger as drug and alcohol abuse rises. U.S. suicide rate surges to a 30-year high. But there are happier trends that have received a lot less attention. The health of American children is improving sharply, and the health gap between the rich and the poor among children and young adults is shrinking. The research suggests that future generations of Americans may not reach old age with the same ailments and inequalities as today's older Americans. Death rates among children always tend to be low, but the new data show large reductions in the number of American children who die. The mortality rate for children has declined by 52 deaths per 100,000 children between 1990 and 2010, according to new research in Science. To put that in context, the recently reported rise in suicides was an increase of less than 3 per 100,000 people. And the death rates fell faster for children living in the poorest counties in the country. The good news for children suggests that it's possible that today's distressing trends can be stopped or even reversed. A growing body of evidence indicates that good health early in childhood can pay dividends later in life. That means that today's children and young adults may grow up to enjoy longer lives and fewer health problems than their parents. There are also new signs that public policy can help reduce inequality in the health of rich and poor Americans. A gulf between the lifespans of rich and poor Americans who have reached middle age is widening. But, among children, the gaps between rich and poor are narrowing substantially. If those trends hold, income level may turn out to be less predictive of lifespan than the studies of adults suggest. We know there's a relationship between economic inequality and health, but it's not a completely mechanical relationship, said Janet Curry, an economics professor and the director of the Center for Health and Well-Being at Princeton University, who conducted 2 recent studies on the reduced death rates among American children. There are things we can do to make the health of poor people better. And we actually have done a lot of these things very successfully, and no one is talking about it. Ms. Curry can't be sure what precise factors have led to the reductions in death rates for poor young Americans, but she has some theories. Public health insurance, through the Medicaid and Children's Health Insurance programs, expanded to cover more children and pregnant women throughout the 1980s and 1990s. Research has shown measurable benefits to the children with access to the program. There was less infant mortality, they were hospitalized less often as they grew older, they were more likely to finish high school and attend college, and they earned more money in early adulthood. Those studies all suggest a real health benefit from the insurance program. Continue reading the main story. Related coverage. The rich live longer everywhere. For the poor, geography matters. April 11, 2016. First rise in U.S. death rate in years surprises experts. June 1, 2016. Black Americans see gains in life expectancy. May 8, 2016. Death rates rising for middle-aged white Americans, study finds November 2, 2015. Laura Wary, who has studied the long-term health benefits of Medicaid expansion, said she thought the timing of the mortality declines was in line with these big social policy changes. It's very encouraging to see that these improvements are happening at younger ages, said Ms. Wary, an assistant professor of health services research at the University of California, Los Angeles.